everyone, this is Ria and welcome to Narika Talk Show. Let's learn together and grow. And today it is a moment of extreme pleasure to welcome a very acclaimed doctor, Dr. Ashwini Sakhalkar, who is present here with us, and she will be answering some of our questions regarding today's topic, which is Carpal Tunnel Syndrome during pregnancy. So doctor, before jumping to the questions directly, please tell our viewers something about yourself.
So hi, I'm Dr. Ashwini Sakhalkar. I have done my MS Obstetrics and Gynecology. I am currently an assistant professor at the Lokmanya Tilak Municipal Medical College at Sion Hospital. My interests are high risk obstetrics and I just love my job.
You need to look at this camera
Okay.
now. Okay. Alright, thank you doctor. So doctor, at what moment would you say was the moment when you decided to become a doctor?
Considering that both my parents are doctors and all my aunts and uncles are doctors, medicine has always been a part of my family. So there was never a question of doing anything else. Of course, having seen everyone work so passionately in this field, I always wanted to become a doctor.
Thank you doctor. So doctor, as the topic itself says Carpal Tunnel Syndrome, so doctor, our very first question for our viewers is, what is carpal tunnel?
Basically, carpal tunnel is a passageway which connects your wrist to your palm. It's surrounded by bones and the median nerve passes through it.
Okay doctor. Doctor, what is carpal tunnel syndrome?
Carpal tunnel syndrome can occur in anybody. It is basically a pressure on the carpal tunnel and effectively a pressure on your median nerve, which is going to cause tingling and numbness of your hands, amongst other symptoms like pain or difficulty in holding objects. The carpal tunnel, this pressure may be because of multiple reasons, but primarily because of a swelling of your wrist.
Alright, thank you doctor. And doctor, what does carpal tunnel syndrome feel like?
Basically, carpal tunnel syndrome, as I said earlier, is because of a pressure on the carpal tunnel. It can feel like, it can present like as numbness, tingling sensation, clumsiness in holding objects, pain in the thumb, in the fingers, in the palm, which can even extend up to your elbow.
Alright doctor. And doctor, what causes carpal syndrome during pregnancy?
So as we all know, pregnancy is a state in which there is swelling of all of your body parts. Along with that, in pregnancy, the lady moves a lot lesser than in other situations. So circulation in your hands or legs is lesser. Because of these things and because of the swelling, there is a pressure exerted on the median nerve, which causes the carpal tunnel syndrome in pregnancy.
So doctor, what is median nerve?
So the median nerve is one of the primary nerves in your arm. The median nerve is going to provide the muscles and also the sensations to your palm and the muscles of your forearm. This median nerve passes through the carpal tunnel and provides branches in your palm.
And doctor, why is pregnancy linked to carpal tunnel syndrome?
So basically, as we all know, pregnancy is a condition in which there is a lot of swelling. So we accumulate a lot of water. Because of this swelling and because of other risk factors like hypothyroidism or diabetes or obesity, it can precipitate or it can increase your chances of having carpal tunnel syndrome.
Okay doctor, and doctor, how early can a woman get carpal tunnel during pregnancy?
So in pregnancy, of course, carpal tunnel can happen at any point, but most of the times we have seen that carpal tunnel happens almost after 7th month of pregnancy, that is 30 weeks of pregnancy. with increase in the fluid accumulation which happens after the second trimester. This is seen.
Okay, doctor. Doctor, what are the symptoms of carpal tunnel syndrome during pregnancy?
Carpal tunnel syndrome in pregnancy is like carpal tunnel syndrome at any other point. There is tingling of the hands, numbness in the hands, there is pain in the palms, in the fingers which is extending up to the wrist. Also there is poor tone in the muscles, so difficulty in holding any objects falling from your hand, amongst others.
Okay, doctor. So, doctor, as you talked about numb hands during pregnancy, so, doctor, how can a woman relieve numb hands during pregnancy and any other symptoms she may experience?
So first and foremost, the woman actually has to find out in which position or while doing which activity these numb hands are occurring. So if you are able to find out which activity is causing your numb hands, primarily stop doing that activity or decrease that activity. Second thing is, if a certain position is causing numb hands, try to freely move your hands. And third thing is other things like rest or cold therapy can also help.
Okay, doctor. And doctor, are some pregnant women at an increased risk?
Of course, some pregnant women are at an increased risk. Women who have hypothyroidism, that is, who are regularly taking thyroid supplementations. Second is women who are diabetic, women who have rheumatoid arthritis, and obese women are at a risk in pregnancy as well.
Okay, doctor. And doctor, what can a person do to relieve carpal tunnel syndrome?
So to relieve carpal tunnel syndrome, of course, we can give the patient some give the person painkillers. The person can try yoga. The person can try rest, cold therapy, and also the person can, of course, the definitive treatment is usage of a splint.
So it's time for a little break now. We will be back in few minutes. Welcome back to Narika Talk Show again. Moving on to our next question. Doctor, how is CTS diagnosed in pregnancy?
So in pregnancy, it can primarily be diagnosed by your symptoms of numbness, tingling, or pain. Along with that, your doctor can also do a nerve conduction study or an EMG for confirmed diagnosis of carpal tunnel syndrome.
Okay, doctor. Doctor, how long does it take to develop CTS?
It can take up to a few weeks to develop CTS, but sometimes 1 to 2 weeks is enough if you have risk factors and if increased chances of developing swelling in your arms, in your hands and your wrist.
Okay, doctor. Doctor, are there any treatments for carpal tunnel syndrome?
There are multiple treatments. There are some treatments that you can do at home. These treatments, of course, involve rest, taking painkillers, avoiding doing things or activities which are going to exaggerate or increase your symptoms. There is also cold therapy and yoga. Other than that, avoiding certain foodstuffs or having certain foodstuffs can also help. Definitive treatment is either using a splint or sometimes even surgery.
Thank you, doctor. And doctor, what is endoscopic carpal tunnel release surgery?
So basically, surgery is the last option in case all the other modalities don't work. Surgery can be either an open surgery or an endoscopic surgery. Endoscopic surgery, as we all know, is by making a 0.5 centimeter to 1 centimeter in skin incision, and a camera is put through it, and then the transverse carpal ligament is cut open so that your symptoms are relieved.
Okay, doctor. Doctor, and on the other hand, what is open carpal tunnel release surgery?
The surgery actually is the same, that is cutting open the transverse carpal ligament. However, in open surgery, a large incision is made on the skin and all the layers are cut open, and then the transverse carpal ligament is cut.
Okay, doctor. So, doctor, how can women prevent carpal tunnel during pregnancy?
In pregnancy, first is to detect whether you are at high risk, trying to reduce your basal body mass index. Second is keeping your if you are hypothyroid, keeping your thyroid under control. Third is if you are diabetic, keeping your sugars under control. And of course, exercise or free motion of your arms, not keeping your arms in one position or your wrist in one position for a very long time can always help.
Okay, doctor. And doctor, what foods can help prevent or treat carpal tunnel syndrome?
So there are a lot of foods that help to prevent carpal tunnel syndrome in many different ways. Green leafy vegetables, your bell peppers can help in treating carpal tunnel syndrome. Omega-3 fatty acids are known to help decrease the inflammation in carpal tunnel syndrome. So foods that contain omega-3 fatty acids like walnuts or chia seeds or flax seeds can be used. Vitamin B6 is also seen to help in treatment of carpal tunnel syndrome. So oranges, bananas, cauliflower, which are rich in vitamin B6 can be used. Other than this, dark chocolate, green tea, olive oil are also helpful.
Okay, doctor. And doctor, will a woman still suffer from pain after her baby is born?
So for most women, after the birth of the baby, all the swelling comes down. So obviously after all the swelling comes down, the pressure on the median nerve comes down. So for most women, the pain or the tingling and the numbness completely settle after the birth of the baby. However, in very few percentage of women, it is said to extend beyond 1.5 months after delivery.
Okay, doctor. Doctor, will having carpal tunnel during pregnancy affect a woman's pregnancy or the baby?
Not at all. Carpal tunnel syndrome itself does not affect the baby in any way at all. It does not even affect the pregnancy or the pregnant woman. However, treatment taken like painkillers that are taken during pregnancy can have an effect on the pregnancy. So before taking any medication, it is better to consult with your gynecologist.
So, doctor, what are some effective home remedies for mild carpal tunnel syndrome?
For mild carpal tunnel syndrome, you can first try some sort of stretching of your wrist, some exercises of your wrist. You can also try cold therapy. Some yoga exercises also help, and rest. Rest is one of the mainstay in treatment of your carpal tunnel syndrome.
And doctor, when should a woman call her doctor or gynecologist about carpal tunnel during pregnancy?
It's always advisable to inform your doctor when you start having symptoms of tingling numbness at the onset itself. Your doctor can help you out with what you can do at home, and if it gets worse, of course, at any time in emergency also it is advisable to talk to your doctor.
Alright, thank you doctor for sharing your informative views on it, and I hope this session was really beneficial and informative to all the lovely viewers out there. But before leaving, doctor, is there anything else that you would like to share with our viewers?
Only thing that I would like to share is carpal tunnel is not a major disease or a major disorder that you need to get stressed about it, but it's always advisable to discuss every little problem in pregnancy with your gynecologist.
Well doctor, that was really a great response, and it means really a lot to us to be with you in an Arika talk show, and I hope
Thank you.
And thanks a lot for your precious time.
Thank you, same here.
So we will all see you in another session with another interesting topic. Till then, to all the lovely viewers, stay tuned and stay happy.